Our speaker today is Lucretia Ryan. She is the founder of financialfreedomforwomen.org. Lucretia is a financial writer, educator, and philanthropist. After graduating from Cornell University and spending her career at IBM, Lucretia is now helping women achieve financial independence. She writes articles to simplify complex saving and investment decisions to help women make financial decisions that are in their best interest. Because Lucretia does not accept any fees, commissions, advertising, or donations, or sell any financial or Medicare products, she is able to expose the hidden fees and financial traps and help women avoid being taken in by financial predators. She has spoken on the topic of Medicare Advantage's dirty little secrets numerous times. She will not only share her personal experience, she will explain how the Medicare choice can affect your health care for the rest of your life. What you'll hear today, no insurance company will tell you. Welcome, Lucretia.
Oh, thanks, Dan. I appreciate that. And I am a big fan of you and Scott. What you're doing for teachers is incredible. So, I want to do my part as well. And people have said, oh, I've heard Medicare seminars. I've been there. No, what I am going to tell you today, nobody else is going to tell you because the insurance companies and the Medicare consultants have absolutely no incentive to tell you what is really going on. So why don't we get started here? Uh, as Dan shared, I don't accept any fees or donations or advertising or anything. And I started this nonprofit foundation, financialfreedomforwomen.org. And I want to share with you how this could be a resource for you before we start diving right into Medicare. So this website, and I'm going to give a shout out to two of my friends who've helped me with this. Emily Roth, who's the web designer, who's fantastic. And then Karen Breslow, who is my legal consultant. We call her Debbie Downer, but she helps out. But I want this to be a resource for you. So as Dan mentioned, I do one-on-one retirement optimization workshops, and I learn a lot. And so then I write articles to share with people. So I have one section, all these articles about making the right retirement decision and things about Social Security. I have another section, choose the best Medicare plan. That's what I'm going to go through tonight. But this is a resource for you that you could go back and read the articles that have more details and good links. I have another section, avoid these teacher retirement disasters. So I use case studies from the retirement sessions that I've done that show really how do annuities really affect you. And then my last one is avoid these financial mistakes, such as reverse mortgages and other topics that I use. So let me get back to the meat of the presentation. So I had to do this for my mother to choose Medicare, and I was clueless. And I would call up Medicare.gov and I'd ask them questions. After waiting online for a long time, they would read me a script. I would ask a different question. They would read me the same script. I'd ask a question. They'd read me the script. It's very hard to find out what's really going on. So I want you to take a look at this chart and keep this in your mind as we go through the presentation so you understand what's going on. So when you turn 65, you have two choices. You've paid into Medicare your whole life. And now at 65, you could choose either original Medicare, and it has a Part A, which covers the hospital services. It has a Part B, which covers the doctor visits and outpatient care and MRIs and that sort of thing. But Part A has a big deductible, and Part B has only covers 80%. So you need another policy to cover the gap That's why sometimes it's called Medigap, but it's really a Medicare supplement. So you get the original Medicare from the government, but then these supplements, which are heavily regulated, you get these by for-profit companies. Then in addition, you need to get Part D, which is a drug plan, and these are for your medications. So this is one choice. And if you go to the doctor, the question is, do you take Medicare? The other choice is Medicare Advantage, and that is sold by a for-profit company, United Healthcare, Cigna, Blue Cross Blue Shield. And that bundles the Part A, which is the hospital, Part B, which is the doctor, plus the drug coverage. And so that is bundled and sold by for-profit companies. And what you're really saying is, when you sign up for Medicare Advantage, you're saying to the federal government, I don't want original Medicare. I want you to pay $1,000 a month to a Medicare Advantage company. They are going to manage my health care. They are going to choose what doctors I can and can't see, what hospitals I can go into. They are going to choose how they're going to pay the doctors, and that's how they're going to make their profit. So you don't have original Medicare. You now have a Medicare Advantage by a for-profit company. And now let me go into some more details about original Medicare versus Medicare Advantage. But I will tell you, if you went through what I did, and I had to sign my mother up, I like, oh, okay, I like Blue Cross Blue Shield. I'll go to their site. They don't talk about a Medicare supplement. They will only talk about Medicare Advantage because that's where they make their profit. So let's go a little deeper on what is original Medicare. As I say, so it covers the hospital. If you go into the hospital, Medicare pays, there is a deductible of $1,632 per visit. If you go visit a doctor, you ask them, do you take Medicare? Pretty much all doctors take Medicare. There's a deductible of $240, and it pays 80% of your Medicare services, MRIs, whatever. In addition, when you turn 65, and then you have to sign up for Medicare, you have to pay a premium of $174 a month to the federal government, regardless of if you choose original Medicare or if you choose Medicare Advantage. You still have to pay that $174 when you sign up. But as I said, you have Part A, you have hospital, you have Part B, which is the doctors, but then you have to buy a supplement plan, which you would buy on Medicare.gov, a supplement plan, and then you have to buy a drug plan. So it's these four things is what you need to do when you get original Medicare from the federal government. And in this case, all decisions, can I get an MRI? Can I get a knee replacement? Are made by the federal government, which if your doctor says you need a knee replacement, Medicare says, fine, we'll pay for it. And then the supplement just pays the difference. You can see any doctor and any hospital in the United States. Pretty much any doctor that takes insurance will take Medicare. Certainly any hospital, all the top hospitals will always take original Medicare. They love original Medicare. Now, if you decide, nope, I don't want original Medicare, I want a Medicare Advantage, this is what you're getting. As I said, and I'm going to kind of keep repeating things over because it's kind of complicated. So, it takes a little while to sink in. It took me a long time to figure this out. And make it as simple as this, because the insurance companies don't want you to understand what is really going on. So you sign up for Medicare Advantage, United Healthcare, Cigna, whatever. They are for a for-profit company. You no longer have original Medicare. So if you go to a doctor, you have to say, do you take Cigna Medicare Advantage? Do you take United Healthcare Medicare Advantage? You don't have original Medicare. So, and I'll just compare it like with my mother. I did not understand this. And she went into an assisted living, and the doctors who came in, I would say, oh, I'd like you to see her. They say, does she have Medicare? I'm like, yep, she has Medicare. And I would give them her card, and they'd say, no, she has Medicare Advantage. I'm like, oh, what's the difference? Big difference. We don't take it because it pays the doctors less, and it has all of these things called prior authorization, which I'll go through. So you're really limited on who you can see. The coverage is often geographic, but it's also specific doctors and specific hospitals that will take Medicare Advantage. For example, you want to go to the best cancer facilities, Memorial Sloan Kettering, you can't go because they won't take Medicare Advantage, most of the Medicare Advantage plans. So it limits you. That's how these companies make money. They pay the doctors less. They limit what procedures you can get, and that's how they make the profit. So your costs, so you have to pay the premiums, which are sometimes zero. And I'm going to show you the Connecticut teachers one in detail so you can see an example. Sometimes it's zero. And I couldn't figure out, well, how could they make any money if they're charging zero? Well, what's going on behind the scenes is the federal government is giving them $1,000 a month, probably a little more now, for each client that they have. And then you also have to pay co-pays and deductibles. And as I said, you also have to pay the Part B Medicare as well. So everyone who signs up for Medicare has to pay Part B, whether they use Medicare Advantage or original Medicare. So, those are your two choices. But the insurance companies don't want you to know that you have a choice. You go to any of those websites and they'll say, oh, Medicare Advantage, because that's where they make their money. So what are the big differences between original Medicare with a supplement versus Medicare Advantage? This is a big one, requires prior authorization. So if you want a knee replacement, your doctor has to apply to United Healthcare and say, here's all the reasons why I want you to pay for the knee replacement. They may accept it or they may deny it. If most of you have regular insurance now, you've dealt with some prior authorization before. And they typically will okay most procedures, but the expensive ones, they may deny it, or they may make you to do other things, or they may say, no, try this lower cost treatment. So prior authorization is a big deal, and you do not have prior authorization if you choose original Medicare. And then at the beginning of the year, the federal government sets Medicare rates. What are they going to pay for a knee replacement? What are they going to pay for an MRI? All of these things, they set out rates. The Medicare Advantage plans pay less. That's how they make their money. They pay the doctors less. So only the doctors who are in their network who will accept this lower pay are the doctors that you could see. And as I said, when you're really sick and you want to go to the top hospitals, like the cancer hospitals, most of them will not accept a Medicare Advantage plan. And the top specialist certainly will not. So Medicare Advantages has limited hospitals and specialists that you could see. So now I told you, if you remember that picture that I gave you, which was on the first page, you choose original Medicare. You have Medicare A, you have Medicare B. Then you have to buy a supplement plan. So you go on to Medicare.gov, or you work with a Medicare consultant who will sell you a supplement plan. And these are sold by private insurance companies. The same, United Healthcare, Aetna, Cigna, but they're standardized. So there's 10 plans, A through N, and they cover different things. But it's more important that you choose the best letter than you choose the best company. So I'll show you a chart that makes this very clear. But right now, the best one that you can get is a G plan. Doesn't go in alphabetical order. Why? I don't know. Just to keep you awake, I guess. But G right now is the best, even though it's right in the middle of the alphabet there. But G is the best. So everyone who offers a G plan, it's exactly the same. So one is not better than the other, maybe better customer service, but they cover exactly the same. So it's more important that you choose the right letter supplement than you choose the right company. And you really, really should think the plan that you choose when you're 65 is going to be the one that you keep for the rest of your life. I'll go through that in a little more detail, but as a general rule, that's going to be true. And the fantastic thing about the supplement plan is if Medicare will pay for it, the supplement has to pay for it. There's no prior approval. They don't get a vote. They don't do anything. They just have to pay their piece of it, and that's it. So very big difference than when they're in charge in the Medicare Advantage plan. So I wrote an article that goes into the Medicare supplement in more detail, which I'm going to link to here. But what this chart is really great. This kind of explains it. So it tells you all these different plans, what they cover. So if you look at the G plan, it covers everything except your $240 deductible. So people say, oh, the US, we don't have a great healthcare coverage. Medicare, original Medicare with a Medigap plan is fantastic. Well, I did this session down in Florida, and this woman shared with me that she'd been healthy her whole life. And then when she was 78, she got cancer. She had original Medicare. Her bill was $1 million. And Medicare with a G plan covered everything except her deductible of $240. So we have a fantastic plan for healthcare for people 65 and older, but no one is incented to tell you about it because that's not where the insurance companies make their money. So let's go back to, so at this point, before I go into more of their dirty little secrets, are there any questions or experiences you want to share, Dan or Scott?
Yeah, we just got a question, Lucretia. Do you need to choose a new supplement plan every year?
No. The supplement plan, you should probably expect to keep for the rest of your life. The drug plan, every year, you should reevaluate. But the way it works is when you choose a plan at 65, regardless, they can't look at pre-existing conditions. After 65, they could ask you about pre-existing conditions. They could charge you, they could deny you, they could charge you 3 times as much. So you have to assume that when you're 65, the supplement plan that you choose is going to be for life.
The same individual had a couple follow-ups. Can they change the supplement plan? And then underneath that, it said the government, I mean. So
No,
okay.
no. I mean, that's what's so fantastic is it's published. It's you pick G, this is exactly what you get. What they can do is they could say G is no longer available. So F used to be the best. So people who chose F, they're grandfathered in, they're fine. But now I don't yet have Medicare. I can't get F, but I could get G, which is the second best. So once you pick it, you're in there, and they're not going to change F, but they may not make it available to future people.
Okay, and then another follow-up. So are you also saying if you have a pre-existing condition at 65, you cannot be denied?
You cannot be denied. They don't ask about it. What the questions you ask, oh, you're a 65-year-old woman, you are non-smoking, and you're in Florida. That's the price you get. You come back at 66, they could say, do you have pre-existing conditions? All these things. They could, look at your medical records. They could deny you coverage. They could charge you 3 times as more. But when you're 65, it doesn't matter. They cannot ask about pre-existing conditions. And that is nationwide.
Good to know. Okay, that is it for questions at this point.
Okie doke. So let's go into their dirty little secrets. And I've sort of been alluding to this, but I just want you to get the whole picture. So insurance companies make significantly more profit selling the Medicare Advantage plans. That's how they make their profit. As I said, you go to any of their sites, if you do Google Aetna Medicare, they won't even tell you about their supplement plans. It's just Medicare Advantage. And that's where they make their profit. They make their profit from the money that they get from the government by paying the doctors less, by denying coverage, and that's how they make their profit. They're adding no value. They're not providing any services. They're just managing everyone's health care, and they're making a profit. They also, you speak to people who love Medicare Advantage. Well, they offer low-cost services like dental. Well, not a lot of people, dentists will take it. Vision, it's not a lot of money. Hearing aids, that is a cost. Gym memberships. People say, well, they pay for gym memberships. Well, if you have to go for cancer treatment, it's going to be $1 million. So, they'll give you these free low-cost services to entice you to get in. Then you start when you're 65, you're pretty healthy. Oh, I want all these little fun little extras. Then you get older and you get sicker and you get some disease, and then you can't switch back to original Medicare because they won't take you because you have pre-existing conditions. Another thing that kills me is the Medicare consultants. They are paid 3 times as much to sell Medicare Advantage than original Medicare with a supplement. They're only paid by the insurance companies to sell the supplement, which is so much less money for them versus the Medicare Advantage. So I had a friend who I told her, go see this guy. He will he'll help you, advise you for a Medicare consult for a supplement. She's like, she spoke to him. She wanted someone to come to her house. She had someone come to her house. She's 65. She signs up. Of course, it's Medicare Advantage. A year later, she gets breast cancer. She's in Connecticut. She can't go to Memorial Sloan Kettering, which is the best cancer hospital. It's an hour and a half away. She can't go because she has a Medicare Advantage plan that these hospitals won't take. And then, as I said, prior authorization is really how they make their profits. And so doctors hate this, hospitals hate this. They have to apply to the insurance, they have to write up a reason why, you know, you should get this operation or you should get this medication. Um, so the physician, otherwise they won't pay for it, so the doctor can't do it. So this is called prior authorization. This is what insurance companies use to um, control their costs, is prior authorization. So United Healthcare was just sued because they're using AI to deny coverage. So, you know, you put in, your doctor puts in a request, like for medication. 3 minutes later, a denial comes back. They're using AI. They don't even have a person who is denying the coverage. Then you reapply, and in 3 or 4 days, they come back with a denial. It's not a doctor who's evaluating it, it's an administrator in United Healthcare who is denying you. Then you could go on a third time, and then maybe they might have a doctor evaluate it and speak to your doctor. But this is what they use, and they deny about 10%, but they deny the high cost ones. You know, people say, oh, I got a great knee replacement from Medicare Advantage. Yeah, that's not a big deal. It's the high cost when you're really sick is when they, will deny it. But patients only appeal. They don't even realize that they can appeal these denials. They only appeal about 11% of the time. And seriously, like when you're sick, that's not when you want to be fighting with the insurance company. I mean, I did this for my mother, but there's no way she could have done this for herself. Um, and as I said, with original Medicare, there is no prior authorization. If it's a procedure that Medicare pays for, your doctor wants it, it's approved. The supplement plan has no authority to say deny or approve. Medicare pays it, they just pay their piece of it.
Lucretia, we got four new questions in. Would you like to address them now, or would you like
Sure,
to wait a
sure, go
moment?
ahead.
Okay. Question one. I retired a year ago, and my school district is providing my health coverage until age 65, at which time I would go on Medicare. May I choose a different plan than the one I am currently on? I'm on Kaiser now, but want original Medicare with a G supplement when I turn 65. I am currently 62.
Yes, yes. When you're 65, it's a clean slate. You go onto Medicare.gov and you choose your plan.
Thank you. Okay, question two, I think you just answered by giving that website. If the insurance companies won't share their supplemental plans, how, where can you find them?
Right. So the way it would work, so I there's a guy that I use and who I worked with, my brother and sister-in-law, Gene Rainey. He's the only Medicare consultant who recommended a supplement plan. So Gene, his number is on my website. I don't get any fee or anything from him. Or you can go on to, and I would advise doing that because it is complicated, or you go on to Medicare.gov and then you say, you could put in, I'm a 65-year-old woman, I live in Florida, I'm non-smoking, I want a supplement plan, I want to see what are the G plans. And then it'll give you about 6 choices, depends where you are, and you choose one of them. So for my brother in Montana, he had Mutual of Omaha. Um, that was like the cheapest plan. So he chose that. He's gonna have to have that for the rest of his life. But you can go on to Medicare.gov and that's how you would do it. That's how you sign up for any plans, unless you have the Medicare consultant do it for you.
Okay. I am 66 and still working full time and have insurance through my school. I signed up for Medicare Part A when I turned 65. When I retire and sign up for a supplement supplemental plan, will I be asked about pre-existing conditions?
Okay, so if you are currently, um, uh, if you currently are over 65 but have existing health care, then when you no longer have health care, then you sign up for Medicare, and it's the same as if you signed up at 65, as long as you could show proof, and your employer gives you a letter every year, that you had other coverage. So as long as you're working and you have Medicare and medical insurance, that's totally fine. When you stop working, that's when you sign up, and it's the same as when you signed up at 65.
Okay, another question. Can you explain how IRMA affects payments?
That's a tough one. Okay. All right. So I told you that uh, you pay $174 a month. However, if your income, your total income is higher, and there's a chart, it's called IRMA. There's an IRMA chart. So if you make, and it's a 2-year look back. So say when you were 63, you made 150,000. And I don't know this off the top of my head, but instead of paying 174, you might have to pay 200. If you made 300,000 as a married couple, maybe you would have to pay 200 a month. So it's a 2-year look back. So I have a great article that goes into the IRMA tax in detail, but you got to work with your accountant to make sure that your income in any one year falls below the IRMA boxes, so that you don't have to pay that additional tax. However, if you retire at 65 and at 63 you had a high income, which is the 2-year look back, you can apply to the federal government for dispensation that I'm not going to have that same income anymore.
And Scott just posted a chart, an IRMA chart, I believe, in the chat.
Yeah, there's a link to a chart that has the income levels and what the premium is at each income level. And the other thing I'd like to add is the IRMAA additional tax is you only have to make that initial dollar amount, just $1 into the bracket, and you pay the whole amount. So, for example, if your income exceeded $206,000 in 2022, even by $1, you're going to pay $245 a month instead of $175. So you really want to be careful when you're taking money out that you're not only maybe exceeding tax brackets, but that you're not going to exceed what the IRMA or what you expect the IRMA bracket to be in the 2 years down the road. They make this easy, don't they?
Scott, is this
So
something a financial planner could help an individual with? Is this common to help with this?
It's what a financial planner should be helping with. Very few know this information. I just happen to study it because it's it's crucial to helping people understand what it's going to cost for their retirement in retirement. So the answer is yes, but it actually most people who call themselves planners don't know this information. So you do need to ask them.
yeah, so in my website, financialfreedomforwomen.org, I have a whole article on IRMA and the links. I have that chart, links to the form to send to the IRS, and it goes into more detail on IRMA. But yeah, Scott, that is an excellent point. $1 over, and you're into the next.
Yep, we just got five more questions have come in.
Okay, go ahead.
So Medicare Original, that is always the primary in control of decisions.
Absolutely. If you choose original Medicare, you doesn't matter who your supplement is. Original Medicare is in control.
Okay, next question. If you move to another state after signing up for Medicare, can it change one's coverage?
Okay, I have a chart on that, but let me go with that now. So if you have original Medicare and you move, I told you Medicare do the whole United States. So you don't have to change it. Your supplement, they're just paying the difference. They're not, so it doesn't matter. So if you have original Medicare, you can keep that same supplement wherever you move in the United States. If you have a Medicare Advantage, they often have restricted, it's just for New York State or it's just for Connecticut. So you would have to switch to another Advantage plan when you move.
Is it good to use a broker to sign up for original Medicare and a G supplement?
If you can find a reputable one that has your best interest at heart, yes. So when I sign up, and I don't get any kickback from Gene Rainey, but I send everyone to him because he takes his time, he explains it. So when I sign up, even though I know everything, I am going to schedule an appointment with him to help me pick, the best supplement, the best drug plan. So yes, if you could find somebody who's not going to try to push Medicare Advantage, then yes.
It just makes me think that maybe the best way to go is a fiduciary advisor who specializes or at least really understands this. And I'm posting a link right now in the chat that a resource we have on 403BYs. If you look at the bottom of this link, it'll show where you can find fiduciary advisors. Okay, we have several more questions have come in. I will have insurance through my district until age 68, but I required to pick up Medicare Part B at age 65. At age 68, when I need to elect a supplemental plan, will pre-existing conditions impact me?
I don't know. I don't know. It would have to be how that's written.
Where would be the best way for this individual to get the answer, do you think, to this question? Would you know, Lucretia,
If
who
they
they
send
might?
me, if they send me an email on my website, so there's a
Okay.
contact me on the website, send me an email and I'll track it down.
Okay, thank you very much for that. And I've posted her website twice in the chat. We'll post it again before the
Yeah,
night's up.
financialfreedomforwomen.org. There's a contact me. You could send me an email through that.
Okay, that's very generous of you. Thank you for that. Another question. If I work until 70 and can be on my company's health plan, may I still switch to Medicare? Should I if I have a relatively high income?
After they leave their job or while they're working?
Let's see, I'll read this again. If I work until 70
Yeah.
and can be on my company's health plan, may I still switch to Medicare? Should I, if I have a relatively high income? So I assume they're probably still working because they would have a high income. So I'm thinking that's what it is. And if not, please, the individual that posted that question, if you want to do a follow-up.
So chances are, if you're still working, you're probably better off with your employer's plan, would be my guess. I mean, I've had people look at the numbers, that you have to look at the numbers of what your costs are. But typically your employer is subsidizing it. It's probably a pretty decent plan. That's what I'm fine with.
And the
Uh,
person did just follow up and say, yes, working, still working.
yeah, still working. You have to look at the numbers, but the people that have done it, have looked at the numbers, they said, oh, I'm gonna stay on my employer's plan or my spouse's employer's plan, which is also. So let me get rolling.
Okay, we've
Uh,
got two more questions. We'll ask them at the next session or next
okay,
stopping point.
so as I said, which I keep hammering home, what you do at your initial enrollment, they can't look at pre-existing conditions. Only 4 states allow you to switch and not worry about pre-existing conditions: New York, Connecticut, Massachusetts, and Maine. You can switch, and the supplement has to take you at the same price as everyone else, not take into account pre-existing conditions. So I'll talk about my mother, but my mother was in Connecticut. She was 96. She was maybe she was 92. She had COPD. They had to take her, and they had to take her at a reasonable rate. But you could only switch at the open enrollment time. So I told you, my friend, she got cancer at 66. Yeah, she was in Connecticut. Yeah, she could have switched in January, but she can't wait. She's got to get treatment now. So, you have to worry about that. And the misleading information is if you go to the Medicare.gov site, they say you could switch every year. Yeah, you could switch to original Medicare every year, but the supplement doesn't have to take you. So it really is very misleading. So a lot of the teacher plans that I see, you allow out of network. So I'll speak to some teachers and they'll say, oh, well, my plan says I can go in network and out of network. Yeah, maybe. But it's only if the doctor will accept the lower rates. So I'll give you an example. My friend Harriet, so she had a plan that was in network and out of network. So she wanted to see a specialist that was out of network. Usually when she sees a specialist, her copay is $20. So she went to the specialist. She said, will you take out of network? They said, yeah, but you pay us up front and then you get reimbursed. So she had to pay list price, it was $200. Then she had to go apply to United Healthcare to get reimbursed. Took about 2 months. She got back $120, so she actually paid $80. So yes, you can go out of network, but often the doctors aren't going to take it. They're going to say you pay up front and then you get whatever you get reimbursed. So it's not great, out of network. So you go to one specialist one time, not a big deal. You get a lot of procedures done, it's going to cost you a lot of money. So there really is a potential for very high costs if you go out of network. And even if your plan says maximum out of pocket of like $2,000, that doesn't cover out of network. They're not talking about out of network. They're talking about in network. But even if you want to go out of network, prior authorization is still required. So, you want to get an MRI and you want to go out of network, that's fine, but you still need prior authorization to get an MRI. And then sometimes these zero premiums, they can be very expensive because your out of pocket can be a lot. So when you're healthy, it's like, oh, it's a great deal, zero. But then you get sick and then you're out of pocket. It could be up, the max is $8,000 a year out of pocket that you could be paying. I went through this, this is if you move. So now I want to kind of bring it all home. I talk about my mother. And I'll talk about a real life example. I put a link in here. So I wrote this article about my mother's experience with Medicare Advantage. And the reason I put it in there is I wanted you to read the 75 comments that people made about their personal experiences with Medicare Advantage. So, that's why I have that link in there. But let me go back. So I'll tell you about my mother. So she was in Queens, she biked, she was very healthy, she ate very well. And she had Medicare Advantage her whole life. And we never knew what it was. I mean, from 65 on. And she never had any problems. She worked out well for her. She was very healthy. Then my father passed away. I moved her up to live near me she was in Connecticut. I'm in New York. And then I moved her into assisted living. And I mentioned this before, that's when I realized she has Medicare Advantage. And what does that really mean? It meant that none of the doctors who came into the facility would take Medicare Advantage because they paid less. I had to take off from work. I would have to drive her to her appointments to find the Medicare Advantage doctors that would take it. it was annoying, but still okay. Then she got pneumonia. She was hospitalized. She was in Stanford Hospital, which is a local hospital. And Medicare Advantage did a nice job of paying for her stay. But because she was in bed for a week, she had to go to a rehab facility. So we had to find a rehab facility that would take Medicare Advantage. And that's when the trouble began. Then the Medicare Advantage, they wanted to limit her stay. Oh, okay, you're done. Get out, get out. We won't pay anymore. So me and the facility, we had to keep appealing to get her stay extended because she wasn't walking. She was bedridden at this time. So finally, time went up. She got sent back to assisted living. The physical therapist who she knew, who was in the facility, who she loved, wouldn't take her because she had Medicare Advantage. Another person who would come in was the only one I could get. My mother wouldn't deal with them. So actually, my son went every day. I'll give him a plug. He went every day, and he got her walking. But so you start getting older, you start getting sicker, and you start realizing the downside of Medicare Advantage. But then she has COPD, she has emphysema, and then they would only authorize an oxygen concentrator in her room. They wouldn't authorize a portable one. So if she wanted to breathe, she'd have to stay in her room. So I was finally able to appeal, got her the portable oxygen concentrator. But then the final straw was the medication that she needed, her inhalant. They said, we're not covering it anymore. So then I switched her to original Medicare. And only because she was in one of those 4 states, she was in Connecticut, was she able to switch. Once she switched and had to wait to the open enrollment, then the doctors who came in were thrilled to see her. The podiatrist was thrilled, the physical therapist. Everything was just so much easier because she had original Medicare plus the supplement G plan. So it made a big difference in her life. Now I want to jump to the teacher's retirement plan. And so a lot of teachers are offered a retirement plan that is subsidized by their union or by their school district, and that's what they take. So New York State operates more like a supplement plan. So you have original Medicare, but you have the supplement, which is fantastic. TRICARE, which is the military that they offer, also operates like a supplement. The Connecticut teachers is a Medicare Advantage plan. So I want to show you that Medicare Advantage plan. And I can't tell you what's the best decision. All I can do is educate you so you can make an educated decision. And so what you want to do is you want to find your plan guide. And that's what I was saying. You have to read the plan guide to to really find out what's going on. But this is Connecticut, so I did the work and I read through it, and I'll show you. And I also did it for IBM because it's very similar. So the monthly cost is a big difference. I compared this to someone who moved to Florida from Connecticut. So it's $36 versus $170. So that's a big difference each month, plus $13.30. So it's really $183 versus $36 a month, and it's more if you chose a Connecticut plan. And then you look at the deductible, and Connecticut teachers has no deductible versus a traditional G plan, which is $240, and then the maximum out of pocket is $2,000. However, as I told you, the G plan pays for everything except your deductible. So the maximum out of pocket is $240. Okay, so now, well, financial, there's a big difference. But this is really where the big difference is what requires prior authorization. So you see with a traditional plan and a G plan, but there's no prior authorization. Whereas you look at everything that requires prior authorization, a specialist, skilled nursing, outpatient therapy, rehab, durable medical equipment. diagnostics, all of these things, most things other than seeing your primary care provider, um, you requires prior authorization. But the copays are very low. So it's not a black and white choice. You know, your copays are very low. So people ask me, what am I going to do when I turn 65? So I'll tell you, IBM subsidizes a plan, but it's only Medicare Advantage. So, and I'm a Florida resident, so I can't switch. So I know when I'm 65, I know that the plan that I choose has to last me for the rest of my life. So my priority is to choose the plan that gives me the best facilities and the best doctors if I'm very sick. I want to be able to go to the top. I want top cancer hospitals if I'm sick. I don't want prior authorization. I just want to show up and get treatment. I'm willing to forgo the additional extras, you know, the gym memberships, the dental. I'm also willing to pay a higher premium than a Medicare Advantage plans, but to ensure that I have the best medical and drug coverage. So I'm going to choose original Medicare and the best Medicare supplement. So that is currently G. And then every year, as I said, I will reevaluate my drug plan because I'll change that every year based on my prescriptions. So, you know, my goal for today was give you a resource, financialfreedomforwomen.org, a resource. You can reach out to me through that. You can read my articles in all the different areas. But what I wanted to make it today is help you make an educated Medicare decision that is in your best interest and not the insurance companies. So with that, I will take any more questions, Dan.
Okay, we've got several more. But I just want to say how impressive this is. And Scott and I are texting each other little conversation about just how frustrating it is in this country to understand and navigate things like retirement. And then you have to navigate this. So we are very lucky to have your good work around this. Okay, four more questions I see. And of course, if people want to post more, we can do that. We can look at those. In your experience, how often are these supplemental plans being modified? Have you noticed they are decreasing coverage for the plans overall?
The supplement, well, if you have a G plan, the G plan is always going to cover the same thing. What's going to happen is they'll stop offering the G plan. And if you retire later on, there won't be as good as a G plan. But if you sign up for a G plan, it's not going to change. As opposed to the Medicare Advantage that you sign up for can change.
Okay.
And some Medicare Advantage plans, you know, the insurance companies decide to drop.
Yeah, another advantage to Medicare government option. I can't believe that the industry was allowed to use the term advantage. It's very deceptive, and that's max of lobbying to me. Okay, couple more questions here.
Well, I
Not sure.
mean, no, the real thing is they shouldn't be able to use the word Medicare.
Ah, ooh,
It's
interesting.
not Medicare. That was confusing to me. You know, I was having this conversation with the doctor. I'm like, oh no, she has Medicare. No, she has Medicare Advantage. I'm like, no, well, what's the difference? It's no big difference. Oh, it's a big difference. You know,
Yeah.
I would have thought the same thing if I hadn't met you. Um, okay. Not sure if I missed this at the start of the lecture, but when can you sign up? Is it 3 months before you turn 65?
right. Yeah, 3 months before you turn 65 and 3 months after. If you miss that, you will be penalized for the rest of your life.
Oh,
There's a you know, a tax that they throw on for the rest of your life. Because they don't want people to wait till they get sick to sign up. So you have to sign up 3 months before or 3 months after that window. You have to, and you have to start paying for Part B, which is $174 plus IRMA if you have higher income.
Lucretia, we get these annual notifications around Social Security benefits. And this is a question for me. are we notified by the federal government around this decision? Or is this purely on is it purely our responsibility?
I don't know.
So there's no
You stop
annual
me.
letter sent to someone who's 3 months out from
Well,
Medicare.
you will be, you'll get an onslaught of Medicare Advantage, you know,
Okay,
mail,
but
and you'll
not
think that's your only option.
but not
I,
from
I
the
don't,
federal government, like a
I don't
Social
know what you get from
Security.
the federal government. I haven't turned 65, so I don't know.
Okay, I was wondering
Yeah, I
go ahead,
believe
Scott.
3 months prior, Medicare will send an enrollment package containing information about Medicare and everything. So
But
I'm
I will tell you, if you try to deal with Medicare.gov and try to figure things out, it's awful.
Oh my gosh. I'm going to
yeah.
read you a comment here that just came in, and then we'll go back to the other questions. But wow, I just attended a pre-retirement workshop offered by my district and did not even realize this was an option. They pushed Medicare Advantage as the, in all caps, only option because it is subsidized by the district. SMH.
It probably is the only option if you want to get the subsidy. That's been my experience. Lucretia?
Yeah, that's exactly it. So that's why I say it's not an easy decision. Like for the Connecticut teachers, they've been told their whole life, oh, their whole career, hey, you're going to get subsidized Medicare. So yeah, you're only paying $31 a month. So what you're doing is you're walking away from that and you're saying, I'm going to be just like a regular citizen and I'm going to sign up for original Medicare and a Medicare supplement. It's not an easy decision to make. So the same, the IBM, they made the decision, we would get a lump sum, but you could only use that money to buy the Medicare Advantage. Me personally, I'm going to walk away from that money because I know I can't switch later, and it's worth it to me to have the best healthcare and to go
Wow.
to the best doctors. So it's not an easy decision.
Wow. Yeah, this makes the 403B look not as complex as we make it out to be. Okay, why would any doctor or hospital accept Advantage plans at all if the rate is so low?
Well, Memorial Sloan Kettering, they could call their shots, they people fly from all over the country. You go to Norwalk Hospital, they need patients, so they negotiate every year with the different Advantage plans. And sometimes, like Sarasota Memorial, they had in the paper, oh, we're not going to take United Healthcare Medicare Advantage anymore. Well, they're going to lose a lot of patients. So, you know, they're playing hardball, but if they're a top facility, they can do whatever they want. People are flying from over. If they're a local hospital, they need their patients. So they they negotiate,
And
and
this is
sometimes
becoming
they drop them.
this is becoming a problem in major for two reasons. One, like in San Diego, this happened. Something like 30,000 people were dropped from coverage because they had Advantage and the system wouldn't take it anymore. The other issue is that in many areas, you end up with a monopoly on healthcare services where one company comes in, they buy up everything, and then they drop Advantage. They'll drop the Advantage people, and it's becoming a real issue. So that's the other reason Advantage can be problematic, is because you may end up in essentially an Advantage desert where you can't get it, or you can't get access to the doctors that you need.
Something to consider when you are choosing a retirement location. Okay, a few more questions. Do I
Absolutely.
understand correctly? The G plan is federal, therefore it is offered throughout the US?
All supplement plans are offered throughout the US.
Okay. We had a question about if it's offered in California, so that answers
So
that question
original
as well.
Medicare, oh, There's some states, and I think it's
Hmm.
like Massachusetts, that don't have the same plan, but um, maybe it's like 48 do. There might be a few states that have don't have the same letters, but I don't know them.
That would just be, they'd have to just check on their own then, whatever state they're in.
Yeah.
Okay. How do I find out what plan I chose at age 65? I'm 68 and still working and using my school district's insurance.
Well, you're using your school district's insurance, so you're not
So
on
she has
Medicare.
this individual, he or she has not chosen yet, then most likely. They're
Right,
simply using their current work based, and
right.
then they can still make that decision
When
at
they
some point
retire,
when they
when they
retire.
retire. Right.
I I'm in New York and have insurance as a retiree through age 68. So retired, they'll be covered through six till they're 68. But again, I have to start Medicare Part B at age 65. Medicare being my primary and my district coverage as supplemental. Is there any reason for me to elect a G Medigap plan as I can continue with my district's coverage as my supplemental insurance for life at 35% of the district's cost?
Right, you'd have to look at the numbers, but I worked with a friend of mine who is New York State. I told you that plan document, you have to look at that plan document. But when I was looking at New York State, what they were offering was a supplement. So I thought it was very good. So, you have to peel it back, but I think she's okay. I think
Okay.
what that district is offering, well, it was New York State. That looks very good.
Okay. That's good to hear. Wow. Okay. This last comment, I think, sums up what so many are posting in the chat. Thank you for being so passionate about this and sharing your knowledge with us. And on behalf of Scott and I, we just can't thank you enough for your time, your expertise. And we've learned so much. And personally, I know I have a lot more to learn.
Well, and I'll also offer, so go to my website, subscribe, you get my future articles. I don't get any advertising or anything. I'm also willing to do this presentation if you get a group together. I'm happy to do that. So thanks for
Wow.
this opportunity. You guys, big fans of you too. You're doing a great job for teachers. So, and thanks for the
Uh,
opportunity, guys.